Good morning, everyone. Welcome to our webinar, Recovery and Resiliency with Real Students. Our program begins now.
Okay, welcome. Good afternoon. My name is Taylor Bryan Turner. I'm the Assistant Regional Administrator for New England Region 1 Substance Abuse and Mental Health Services Administration, also known as SAMHSA, within the U.S. Department of Health and Human Services. I'm joined today by my colleague, Tim Jean. We are together today to recognize National Youth Substance Prevention Month. President Biden declared October as an opportunity to relay our commitment to preventing substance use among our nation's youth, including alcohol, tobacco, illicit drugs, and misused prescription medications, by bringing communities together to find local solutions. And by the way, Take Back Day is this Saturday. Please check your local listings to see where you can bring unused medications. Well, today we're celebrating Massachusetts Recovery High Schools and their effort each day dedicated to intervention, prevention, and recovery services. A lot of recovery ideology originated from New England, including recovery-friendly workplaces out of Rhode Island and New Hampshire, and with 5 recovery high schools in Massachusetts. William Ostagai was the first high school to be accredited by the Association of Recovery High Schools in the nation, for which Roger Ozer is the principal and the national chair, and of course, among our esteemed guests today. SAMHSA's core mission is to reduce the impact of substance use and mental illness on America's communities. Our top priorities remain preventing overdose, enhancing access to suicide prevention and crisis care, promoting children and youth behavioral health, integrating primary and behavioral health care, and using performance measures, data, and evaluation to improve our programs. Embedded in each of those priorities are cross-cutting principles: equity, recovery, finance, and building a stronger and more diverse workforce. SAMHSA has produced a wide range of resources, from the Back to School After COVID toolkits and the Talk They Hear You app, an interactive website that helps adults have important conversations with their children. Studies show that teens experiencing high levels of stress and anxiety due to the pandemic were more likely to use alcohol or drugs. Drug overdose deaths are rising during the COVID-19 pandemic, and Massachusetts is no exception. For the first 9 months of 2020, we had a 2% increase. In the first 3 months of 2021, there were 99 confirmed opioid-related overdose deaths, and the Department of Public Health estimates that there will be upwards of 400 more. SAMHSA prevention works upstream, building community impact and intentional strategy, and we need it ingrained across the continuum. We have an opportunity to use our homes, our schools, community centers, YMCAs, WCAs, YWCAs to serve as prevention hubs. We need to get the education out about how harmful drugs and alcohol can be so we can prevent the loss of a loved one. I don't want recovery high schools to be something that people find out about because they become the victims of trauma, right, and need to seek them out. I want people to know that these supportive and holistic schools exist right now, and they can be supported, elevated, and referred to a friend or family in need. Because I had the pleasure of meeting Roger Ozer and was blown away by his passion and dedication, I'm thrilled to share today why and how commitment and collaboration are so important to human development. Recovery high schools and SAMHSA have a strong synergy, and we want to ensure that parents, community members, educators, crossing guards, right, have the tools they need to have honest conversations with our youth about how they are feeling and ending stigma at every corner and every doorstep. We know that behavioral health is a continuum of prevention, intervention, treatment, and recovery support services for mental and substance use disorders, and are essential elements toward ensuring the health and longevity of individuals, families, and communities. So thank you so much for being with us today and for your commitment to prevention work and parents and leaders of tomorrow. Before I turn it over to our special guest, one of our special guests, I want to see if Sam was able to join us again.
Sure. Sam is trying to switch over to his phone right now. And So we'll just stand by. We'll work him in when I'll be able to work him in when he gets in. So.
It is never too late for Sam. We're so honored that he's joined us today. I will move along to our special guest from our headquarters office. As many of you know, SAMHSA has launched a new Office of Recovery. And here to talk about this exciting development, I'm happy and honored to turn the agenda over to Donna Dimitrovic, currently serving as Senior Advisor for Recovery at the Substance Abuse and Mental Health Services Administration in the U.S. Department of Health and Human Services. Donna supports recovery initiatives across the agency. In her previous role, she served as the director of the Center for Substance Abuse Prevention, where Donna provided executive leadership for federal efforts to improve the nation's behavioral health through evidence-based prevention approaches. Ms. Dimitrovic is an experienced executive addiction and recovery specialist with over 34 years in the substance use field. She has experience in raising public awareness and supporting program development for individuals with substance use disorder through advocacy, policy, and program development. And I want to keep talking about you, Donna. Prior to arrival at SAMHSA, she served as the executive director for the Foundation for Recovery in Las Vegas, Nevada, where she developed and implemented peer recovery support programs, education and training on peer supports, and led the organization's growth to a statewide agency. And lastly, as the Chief Operating Officer for the RAISE program in Pennsylvania, Ms. Dimitrovic assisted the CEO launching the buprenorphine coordinator program, serving opioid-dependent individuals with recovery support services and MAT, medication-assisted treatment, one of the first in the country, which received 2 national awards for innovation. So Donna, thank you so much for being here today.
Thank you so much, Taylor. So as Taylor said, my name is Donna Dimitrovic, and first and foremost, I identify as a woman in long-term recovery. And I'm really happy to be here today to take part in this conversation around recovery and resiliency for students. I'd also like to give you a little bit of background on what's happening at SAMHSA with the Office of Recovery and our cross-cutting principle of recovery. So as you know, SAMHSA's mission is to mitigate and reduce the impact of substance use and mental illness for all Americans. While we are undertaking a more robust strategic planning process, we have identified 5 core near-term priorities that will guide our efforts and focus as the broader strategic planning takes place. One of the Assistant Secretary's top priorities is also to help revitalize and re-energize SAMHSA. So the leadership team is looking at identifying and hiring individuals with a deep understanding of behavioral health and management expertise. So with our 5-year strategic planning process, we realized that given the new administration's goals, the devastating impact of the pandemic on behavioral health, SAMHSA really needed to reassess its priorities. So there were numerous conversations with partners and leaders and sister agencies looking at what we determine are the 5 core priority areas. And those 5 priority areas are preventing overdose, enhancing access to suicide prevention and crisis care, promoting children and youth behavioral health, integrating primary and behavioral health care, and then using performance measures, data, and evaluation. Because we all know if we don't have the data to back up all of the great work that we're doing across the country, it really doesn't mean anything, right? We need to be able to tell our story. So in addition, we also outlined the 4 cross-cutting principles, which Taylor talked about. And the most important, of course, for the Office of Recovery is recovery, which is to promote and support new evidence-based treatment and recovery practices, the emergence of a strong and proud recovery community, and the dedication of service providers and community members across the nation who make recovery in all its forms possible. So SAMHSA has supported recovery efforts across over the years, and I'd like to talk a little bit about how we plan to move forward with our Office of Recovery. So in 2010, SAMHSA brought together leaders in the recovery community, both mental health and substance use, to develop a working definition of recovery. It really has withstood the test of time, which is recovery is a process of change through which individuals improve their health and wellness live self-directed lives, and strive to reach their full potential. We will be revisiting that over the next several months with both internal and external stakeholders to take a look at whether, we need to make some changes. And maybe we don't, I don't know. But I think it's important that we all have our voices heard to take a look at this message and determine whether we need to refine it a little bit. So we know that the definition is not an end state, but rather a process. So complete symptom remission is neither a prerequisite of recovery nor a necessary outcome of the process. Recovery can have many pathways, which includes professional treatment, clinical treatment, use of medications, peer support, support from families, programs in schools, and faith-based organizations, and many other approaches. And then we have our 4 major dimensions that support a life in recovery, which are health, home, purpose, and community. So SAMHSA established a recovery support system or systems to promote partnering with people in recovery from substance use and mental health disorders and their family members to guide the behavioral health system and promote individual program and system level approaches that foster health and resilience, increase housing to support recovery, reduce barriers to employment, education, and other life goals, and secure necessary social supports in their chosen community. I am really very excited to speak about our new Office of Recovery, which demonstrates SAMHSA's commitment to recovery as a cross-cutting principle throughout our agency's policy, services, and programs. Mental illness and substance use disorders, which have been exacerbated by the COVID-19 pandemic, are like any other medical condition and require access to support and resources so individuals can live a full, productive life in community. SAMHSA believes in recovery, recognizes the importance of including families, loved ones, and allies. If people are struggling, they don't need to struggle alone. Services and supports are available across the country, which can help people find long-term recovery. An Office of Recovery will elevate the importance of reducing barriers and challenges and encourage support to individuals, programs, and system-level approaches to foster health and resilience. The Office of Recovery is committed to working agency-wide to ensure policy, programs, and services are in line with the principle of recovery and recognize the value of individuals with lived experience. 1 second, I'm sorry. Okay, so sorry about that. So the objectives that outline our plan for the Office of Recovery ensure that recovery is a guiding principle across all of our policies, programs, and services. Promote the involvement of people with lived experience throughout agency and stakeholder activities. Identify health disparities in high risk and vulnerable populations and ensure equity for recovery support. Foster relationships with internal and external organizations in the mental health and substance use field. Promote recovery-oriented public education and training opportunities. Explore opportunities to partner with the private sector to support innovative programs to address disparities and advance the development of recovery-oriented systems, and then support the implementation of all initiatives that provide resources to states for recovery support services, including working with the National Centers of Excellence, in particular, the Peer Center for Excellence. So just to note, the office is in the planning stages. We're just in the process of planning and developing the office, but I have been meeting with stakeholders both internally and externally to gain feedback and ideas on how best to ensure that our Office of Recovery has value to the field. The Office of Recovery really shows our leadership's commitment to the continuum of care. So that includes prevention, harm reduction, or interventions, treatment, and recovery. So it goes across the spectrum of support. One of the things that as I talked with Taylor about, the prevention and recovery really can be interchangeable. If you look at the trends that are happening across the country, there are many service organizations that are providing both prevention and recovery support services. And as a woman and family member of those in recovery, when I came to SAMHSA and began my work in prevention, I realized that prevention really was an important part of the continuum. one, because I have grandkids, right, that really will benefit from prevention activities. And two, that there really is a strong connection. When I look at my own personal recovery, it really is to help support prevention of the recurrence of symptoms. And so, you know, I know we will explore this as we move forward. And primary prevention has a distinct service that it provides, but I think there are opportunities with prevention across the lifespan that can also connect to recovery support services. I just want to add, as I conclude my remarks here today, that in my prior position in Nevada, I had the opportunity to work with Mission High School, which was a publicly funded high school, and saw what a difference that the high school made for kids that were attending there. They had the chance to have peer support in a safe environment from the regular school system or in Las Vegas. And it also was an opportunity for students that had a living environment that was not conducive to recovery, have the ability to go and have a safe place and peer support and counseling and other support services. So I really do believe that recovery high schools support students and have the ability to balance academics with social emotional skills. And it really is the ability to for kids to build relationships of trust and understanding. And I am really looking forward to the discussion today. So thank you so much for the opportunity. And I will turn it back to Taylor. Thank you.
Thank you, Donna. Thank you so much for being here and giving us a bird's eye view into what all that you are working on right now. We wish you continued success and good luck. And we're just overjoyed about the new Office of Recovery. We can't even tell you. I think Sam is back with us, and I would love for him to truly begin the discussion before we turn it over to the panel. So Sam, if you can hear us, please, we'd love for you to join us.
Yes, can you hear me? All right, so should I just share a bit of my story?
Yep.
Sure, go on.
You do.
Okay, so I'm 17 right now. My story kind of starts when I was 12 years old. I was invited over to a friend's house, and he got a bottle of vodka, and then I took my first drink, and ever since my first drink, I knew I was going to be an alcoholic. I loved the taste. I loved the feeling. I loved just doing something I know I shouldn't be doing. It just felt really good. And I got sick, and I threw up, and I fell down the stairs, but I couldn't wait to do it again the next day, and I did. And then I just kept drinking. I started smoking weed, and then a couple years later, I got addicted to Ritalin. And I got a Ritalin prescription, and then I kept doing Ritalin every day. Drug use got more and more frequent, and like the drugs got harder and harder. So it got to the point where like I couldn't go to sleep without drugs. I couldn't wake up without drugs. I couldn't do anything without drugs. I never left my room. I never left my house. I was really depressed, and things just kept getting worse. I got sectioned to a hospital maybe 8 times, and then I got sectioned to detox and rehab once. I just graduated Cushing House in South Boston, which is a treatment program for adolescents. And that's my 3rd time in rehab, but this time I finally graduated. And I'll be getting my 5 months sober on Thursday, actually. And just by staying sober and working on my life, things have been getting a lot better. I work 28 hours a week now, and I have like a 95 in most of my classes. And honestly, it's thanks to AA and like people like the staff at Ostagai. Ostagai's been helping me. Ostagai's been helping me a lot lately with kind of just discovering myself and staying sober. Because at the school I used to go to, there's like 35 people in each class. At Ostagai, it's a lot smaller, and there's like a 1-to-1 student staff ratio. So it's really easy to get help when I need it. And the work's a lot more manageable, and there's actually teachers there that know about substance abuse and like how to help us rather than just send us home. So I've been getting a lot of help and support in South Boston. I still come up for AA at least once or twice a week.
Thank you, Sam. We are so proud of you. Congratulations to you. If you see in the chat right now, we are all rooting for you. Thank you for inspiring us today, kicking us off. You are the reason that we are here. And we're thrilled to hear about the recovery supports that you're getting at your recovery high school. Thank you so much, Sam. I've heard you speak twice now. I look forward to hearing you speak in the future, again from a podium. You are terrific. Thank you so much.
Thank you.
I'd like now to introduce you to our moderator for the remainder of the program. I've had the pleasure of meeting Scott in person for the first time yesterday in Millinocket, Maine for the ribbon cutting ceremony for the first healing and recovery center of its kind for tribal nations, Wabanaki Public Health in New England. It was extremely inspiring, and I'm so glad we had our PTTC with us to celebrate. Thank you, Scott, Erin, and Jessica for your enthusiasm in making today possible. Director Scott Gagnon is a certified prevention specialist, Associate Executive Director of AdCare, Educational Institute of Maine, Inc., and Director of SAMHSA's New England Prevention Technology Transfer Center. Scott is a national speaker on a variety of prevention topics, including cannabis policy and prevention, opioid prevention, and prevention workforce development. Scott currently serves as a co-chair of the National TTC SPURT Coordination Work Group, and Scott has previously served as co-chair of the Prevention Task Force for the Maine Opiate Collaborative. Scott also previously served on the SAMHSA Center for Substance Abuse Prevention National Advisory Council. His work has been recognized with awards and from multiple organizations, including the Maine Alliance to Prevent Substance Abuse Healthy Androscoggin and the Maine Public Health Association. In 2017, Scott was the recipient of the Patrick Kennedy Outstanding Advocate Award. Thank you so much, Scott, for being our moderator today.
All right, thank you, Taylor. So on behalf of our team at the PTTC, I want to welcome everyone to Recovery and Resiliency with Real Students. New England PTTC is a proud sponsor and coordinator of today's webinar. We are funded by SAMHSA through a cooperative agreement to provide training and technical assistance to all those doing the work of prevention in New England. The New England PTTC is proud to support prevention professionals and coalitions across our 6 New England states in building capacity and expanding the utilization of evidence-based prevention programs and initiatives with a focused eye to ensure these services are not just science-based, but also informed by cultural humility and adapted, developed, and implemented to serve all youth and families in our communities. If you want to learn more about us, Sarah's going to put our website in the chat, so you can learn more about what we do at the New England PTTC. Taylor mentioned the proclamation for Substance Use Prevention Month. In his proclamation, President Biden emphasized his administration's resolve to expand evidence-based prevention programs along with access to care and recovery support services. He also stressed the importance of bringing communities together to find local solutions. Working across the continuum, bringing local sectors together to solve these issues, those are the very themes of what we're going to be talking about in today's webinar. And as you hear from our panelists, you'll see those themes come through. So for the rest of our program, we're going to turn it over shortly to Roger Ozer, who's going to give you an overview of the Recovery High School model. After that, we will introduce the rest of our panel for some discussion. If you do have any questions along the way, please do put that in the Q&A box at the bottom of your screen, and we'll get to those as time allows. With that, I do want to introduce Roger Ozer to the virtual stage. Roger Ozer has served as a principal at ABCD's William J. Ostagai Recovery High School since its inception in October 2006. Ostagai High is one of the first high schools in Massachusetts for young people in recovery for substance abuse addiction and the first recovery high school to receive national accreditation by the Association for Recovery Schools. Roger believes in the importance of community involvement and partnerships, and in addition to currently serving as a chair of the Association for Recovery Schools. He previously served as a co-chair of the Boston Youth Service Network. His participation in the Massachusetts Education Policy Fellowship Program has allowed him to continue to develop his skills, not only as educator, but also as an advocate for students and school communities who are in danger of being marginalized. Currently, Roger is participating as a Lynch Leadership Fellow at Boston College, with a goal of continuing to increase the impact of his efforts working with underserved populations. He holds a bachelor's degree from the University of Pennsylvania and a master's degree from the Citadel. He is joined this morning by his colleague, Ryan Morgan, principal of Independence Academy. With that, please take it away, Roger and Ryan.
Awesome. All right, thank you, Scott. I was frantically trying to chat you to say skip the introduction so we could get back on time, but thank you. I appreciate it. And I'm glad that we were able to hear from Sam before my remarks to kind of frame why we all do this work. And something that Donna mentioned about you don't need to struggle alone, right? Everyone at Recovery High School, that's the message. You're not alone. We're together as a community. We share in our successes, and we're there to support you when you're being challenged. I real briefly wanted to just give you a quick overview of the Recovery High School model before we go into the panel, so that people have an understanding of at least the structure. Now that you've seen, at least you've got a little bit of a face put to it by Sam. But here in the first slide, you can see what defines a Recovery High School. And also in the chat box a few minutes ago, I put in a 2-pager, which is also linked in this presentation, which I'll also put in the chat box. But it's really important that we're trying to work with students in recovery from substance abuse, co-occurring disorders, meeting the state requirements. All the schools have to be able to give out a high school diploma. And really importantly, we want to be working with students that are committed to making the effort to make change, to work a program, however they define that, to change their relationship to drugs and alcohol. And it's very important to us that our schools are available to anyone who's eligible to attend high school. We want to make sure that there's access for everyone. So that's just kind of the framework of what a Recovery High School is. And I'm just going to run through a few more slides before we get to our panel questions. Giving you a sense nationally, there's 45 schools. You can see the average lifespan of a school is 9.5 years. Ostagai High, which I'm the leader of, started in 2006. And you can see from the national map where the 42 schools are located. And you can see there's a cluster here in New England, and that cluster is Anchor Academy in Providence, and then the 5 Recovery High Schools in Massachusetts. And Ryan Morgan, who's going to speak in a few minutes, is the principal of Independence Academy in Brockton. And then there's 4 other Recovery High Schools. So within our regions and then across the country, we would try to work very closely together to share our experiences and to support one another as we continue to develop this model to support the young people we work with and the communities the best way possible. I put this slide in there because I think it's really indicative of the fact that there's a lot of young people who are struggling with substance use issues. The percentage of young people who are getting support is relatively small. As you can see, how many young people don't get treatment for a substance use problem. And that doesn't even get to the piece where we're going to kind of focus on a little bit today on our conversation about all the young people on the front end who don't have diagnosed substance use disorders, but need a space to reflect on and figure out what their relationship to drugs and alcohol and if it's impacting them negatively. So it's an incredibly large number of young people that we need to make sure that we have different types of services in place, not just recovery services, but prevention, education, early intervention. I'm going to skip over this because for timing, you'll have the presentation. But a lot of times people say, what makes a Recovery High School different? And you saw in the opening slide, the basic framework. But like for the Recovery High Schools in Massachusetts, these are all the different components that we provide to our students and to our families. All the schools have identified recovery support personnel, licensed recovery support personnel. They can be clinical, substance use, combination thereof. We're working with all the local school districts to support students transitioning into the schools, and if they're going back to the communities. Family support is a huge aspect of what we do, and just this concept of comprehensive care management. It's not just about their relationships to drugs and alcohol, supporting their social emotional well-being and their overall health and wellness, so that they're putting as many tools in their toolkit as possible to go forward and be successful in the community as they graduate from Recovery High School, and go forward in their journey in recovery and in life. And this breaks down some of the specific things that comes under those categories, which we're not going to go into detail, but some of the things to highlight is we do ask on the recovery that students develop a plan, outside of school that they're going to work. Most schools have drug screenings, groups that are focused on recovery. That's kind of the foundation of the school. It's like schools built on the foundation of recovery culture. And then the other three categories, you can see the different components that go into that piece. Family support being a huge one for all of our schools. Before I turn it over to Ryan, I think, this is always my favorite slide in the presentation. It's the stages of change. We're recovery high schools. And so we're supposed to be working with students who have gone through the stages of change or in the maintenance. But the reality of it is in Massachusetts and maybe across the country is access to quality treatment or counseling options is not equal. It's not equitable. And it's not fair that recovery high schools are only available to a portion of students who can access support or help. So although our focus is working on students who are in recovery or maintenance, as far as our shifts, we're doing a lot more work with students directly in their schools, in their communities, to try to kind of find spaces where they can work through their conflicting emotions about drugs and alcohol, go from pre-contemplation to contemplation and take action. And I think the panel today, we have Sam here from DESE and Bryan from BSAS have worked really collaboratively across sectors to come up with different types of funding program models that allows us to connect with students at an earlier stage so that the recovery high schools can be more impactful in our communities. Why we do this work, this was just a study that was done in the Massachusetts school. I'm not a dramatic person, but these schools do save lives. And the only way these schools exist is we collaborate cross sector and get support from organizations like the Bureau of Substance Abuse Services in Massachusetts, the Department of Elementary and Secondary Education. And we absolutely have to work together and can't be in silos to provide the best possible services for our students. And in a time like this, where here's the shifts that we're seeing, we have to work together. I think in Massachusetts, education and public health has done a great job, although a lot of the treatment programs have been the reduced capacity or closing. They've been replaced by different types of program models to connect with young people more directly at an earlier stage. So even though treatment options have decreased, there's been an increased emphasis on prevention, education, early intervention. That's really allowed us at recovery high schools and across the continuum to connect with kids where they're at. So, sorry, that was a little bit but rushed, but one of the themes that we really wanted to get from today is the importance of this cross-sector collaboration, especially at a time like now, coming out of the pandemic, hopefully, and even before that in Massachusetts, seeing that we needed to make shifts to meet our students and families and communities where they're at and provide them the services that they need. And I just want to turn it over to a few minutes to Ryan Morgan at Independence Academy, who's been extremely innovative and is in the process with support of BSAS and the Department of Elementary Secondary Education, trying to adjust and rearrange his model so that we can serve as many students as possible. So Ryan, let's turn it over to you for a few minutes to talk about what you're doing at Independence.
Thank you and good morning to everyone. I think just to kind of cut to it, Roger had mentioned a couple of things, one being access to treatment, and I would also kind of throw in there like perception of a need for treatment. And what we've seen over the past few years, at least in Massachusetts in this region, is a decline in youth going and seeking treatment for substance use, detoxification, and stabilization. And we know that there's a number of students out there who are still using and whose use is problematic. However, I think what we're trying to sort of recognize is that their perception of their use doesn't warrant any level of like real in-depth sort of treatment and engagement with some I think traditional interventions. And so in addition to running the Recovery High School here at Independence Academy for students just like Sam, and I just want to give him a ton of credit for the hard work that he's gone through and continues to work through, We run that part of our program, but we also just received SAMHSA funding, through Bryan, Jenny, and Mass DPH to run what we're looking at as a 45-day program to engage the students that Roger was talking about in the stages of change that are maybe pre-contemplative and contemplative, but instead of taking them in and trying to maintain their recovery and their recovery efforts post-treatment, what we're trying to do is maybe sometimes serve as the initial step for students to start to engage with people who are looking at recovery, again, through the SAMHSA lens of this engagement of a process of change to improve my health and wellness, live a self-directed life, and reach my full potential, while considering substance use as a piece of that. So, in this new sort of program that we're running, again, we're trying to be a more developmentally appropriate model that that bridges sort of the education world and the treatment world. And we're trying to look at things through this lens of what we're calling recovery capital. And so we take the students in and we're evaluating their life on these 10 domains that we've identified through the research and the literature and through our experience. We're helping students kind of take a big step back and develop an awareness around their use, around their mental health, around the relationships that they have with people at home, around their social relationships and their connection to school. And we're really trying to just kind of help them start to take a holistic look at, how is my use right now impacting my life? How are my relationships at home impacting my life? How is my mental health impacting my life? And trying to do some really, intense short-term work with them around those areas, not saying that you must be sober, but, it seems like your use is becoming problematic. These are some of the, strategies that we would use to address that, to address your use. But just like your use is becoming problematic, so does sort of your relationship with your family at home. And these are the steps that we recommend that you use to address that. Your anxiety seems to be becoming problematic, and this is what we recommend. So instead of really a focus on substance use and sustained sobriety, really trying to engage young people from the lens of, we're going to look at your life holistically, try to, just build awareness within you, help you create a vision for yourself moving forward, and then help you take the action steps moving forward. So this is sort of, in response to, there's a number of kids out there who aren't getting, treatment or receiving treatment or engaging with treatment for substance use. We know that. So instead of being frustrated with the system, let's start to create a model that will hopefully engage more youth that might kind of put them on the same path that Sam is on, where, he's engaging with the systems that are out there. He's engaged with the recovery school, and now he's starting to sort of, feel like he's finding himself and building a better life for himself.
All right. Thank you very much for the great presentation. So at this point, I want to bring in and introduce the rest of our panel for our discussion. So our three additional panelists are Bryan Jenny. Bryan Jenny currently serves as the Director of the Office of Youth and Young Adult Services for the Massachusetts Department of Public Health's Bureau of Substance Addiction Services. Prior to this, Mr. Jenny served as a Mental Health Director and Regional Mental Health Director for the Massachusetts Partnership for Correctional Healthcare, a vendor agency for the Massachusetts Department of Correction. Mr. Jenny has over 20 years in the field of youth intervention and treatment services. Samantha Graham. Samantha is a substance use prevention intervention specialist at the Massachusetts Department of Elementary and Secondary Education. Prior to her work at the department, Samantha had 13 years of experience working directly with children and adolescents with mental and behavioral health concerns and co-occurring disorders in crisis intervention and partial hospitalization programs. And Dr. Sarah Becker. Dr. Sarah Becker is an associate professor in the Center for Alcohol and Addiction Studies at the Brown University School of Public Health. Dr. Becker is a director of the New England Addiction Technology Transfer Center, which works in partnership with the Prevention and Mental Health TTCs to meet the training and technical assistance needs of our regional behavioral health workforce. She is also a licensed clinical psychologist and clinical researcher who conducts programmatic research focused on promoting the uptake of effective addiction treatment in community settings, with specialized focused on improving the care of adolescents. So I want to welcome the rest of our panelists to the discussion. And I'm going to start with our first question. And just for our attendees, if you do have any questions you have along the way, please put that in the Q&A box. And as time allows, we'll get to those after our discussion. So our first question, this is throwing this out for all of our panelists to weigh in on. Roger mentioned a shift in strategy, your divisions and how they reflect the needs of recovery high schools. Have you shifted as well? And if so, what does that look like with your programs with respect to recovery, prevention, and intervention? So who would like to start us off with that?
Yes, Scott, I can certainly start from the DPH BSAS perspective. Again, in 2018, the school shifted from DPH BSAS oversight to DESE oversight, but we've still continued to see the recovery high schools a very important and essential part of our continuum. As Roger alluded to, we have seen a decline in the number of youth coming into our residential treatment program. So we have shifted kind of the emphasis from treatment over to intervention, really trying to catch youth early before they make some unhealthy decisions. In doing that, we've taken a look at some of the funding that SAMHSA has been able to provide. And in coordinating efforts with the recovery high schools, we were able to secure funding for after-school enrichment programs. These programs are geared not only for the recovery high school students, but also students from whatever catchment area those students serve or those schools serve, so that they're really able to reach a broader collection of students. So that's one of the shifts that we've made to continue the partnership with the recovery high schools. And then Ryan also alluded to our school-based day treatment program that we have, again, in kind of trying to catch students earlier. We're piloting a program that will hopefully be able to secure blended funding through both the school districts and through Mass Health, our state insurance provider, to provide early intervention and assessment services for youth. It really creates a bridge for students either stepping into a treatment program or stepping out of a treatment program and needing transition back into the community. So we really, we've really shifted our focus from kind of the residential treatment to more community-based supports, really to continue our relationship with the schools. Again, the recovery high schools are an important and essential part of our treatment continuum. So though oversight of those programs moved over to DESE in 2018, we still work in partnership with them. So,
thank you. Samantha, would you like to address that question?
Yes, as Bryan said, the recovery high schools oversight transferred over to DESE, but we still work in collaboration with Department of Public Health and have conversations on how we can best support the recovery high schools throughout the Commonwealth. Currently the Department of Elementary and Secondary Education is working in collaboration with the recovery high school leaders to create a framework that represents the shift that they have seen and how we as a state can best support them and the needs of their students.
Sarah, a question for you. What does the latest research suggest about the directions for recovery high schools?
Sure. So before I jump in, I just want to say, as a clinical researcher that focuses on the optimal treatments for adolescent substance use, it is so inspiring to be part of this panel, because what you hope is that the research matches the clinical service that you're seeing in the field. And what we are hearing from Roger and Ryan and what we heard from Sam, his experience, is all truly best practices. And so what I want to share for those that are on the call is just a few principles. If you are not fortunate to be in a state that has amazing programs like the ones we've heard, or if you are thinking about starting a recovery high school or supporting one, advocating for more resources in your state, just some principles of what are some of the most effective elements in these settings. And I just have a few. The first is exactly what we heard Roger talking about, and Ryan. We have to treat the whole teenager and not just the substance use issue within recovery high schools. When you look at the data in recovery high schools, over 50%, in many settings, closer to 80% of teens have co-occurring disorders. Most have co-occurring trauma. And so within recovery school systems, really addressing the entire teenager from a trauma-informed lens and being sensitive to the traumas that they've experienced is really a key part of creating that therapeutic environment for the teen on their path to recovery. A second issue is we have to try and engage the family and the parents. Many kids for recovery, when we look, my team recently did what's called a meta-analysis. So for those that aren't researchers, it's basically you throw a lot of studies together and you look at what are kind of the key ingredients that help adolescents. Studies that involve just teens, so programs that involve the teen only, don't do as well as treatment approaches that involve the teen plus someone in their family system. So we know that recovery schools that are able to involve parents and teens tend to be most effective. The key caveat is that not all teens have stable families. So in those cases, you can involve a concerned significant other, loved one, friend, relative, but having someone outside of that school system that can help to keep that kid on the path to recovery is really critical. And then a third thing is that, and I also think we heard some really beautiful examples of this from our friends here in the panel, is addressing the social determinants of health. Kids come into treatment and the path to recovery, many have issues with poverty, violence, structural racism. And so we need to be doing exactly what Bryan's office was talking about, of casting a broader net. Historically, when you look at recovery high schools across the country, about 80% of kids are white, and most have above average economic backgrounds. And that's partly because in many states, they're not publicly funded. And so we need to be offering a broader net of these schools to reach kids that are from Black communities, Latin communities, Indigenous communities that are often disproportionately affected by problems related to substance use. And then the final principle is we need more money for recovery programs. There's only 45 in the country. There were 35 the last time a scan was done in the research in 2014. And they are effective and they are cost effective. So advocating for more funding in your state, advocating for more publicly supported schools is obviously something we'd love to see more of.
Thank you. Hi, Bryan, Samantha, this next question is for you. Since the onset of the pandemic and speaking of money and financing, with increasing grant dollars becoming available, which unique cross collaborations or new partnerships have you been able to expand or create due to additional resources and need for recovery high schools?
Bryan, I'll jump in first because Bryan's going to be able to answer this a little bit better than I can. So as far as DESE is concerned, the recovery high schools throughout the Commonwealth are actually publicly funded schools through a grant. And so as far as extra funding, it comes down from a line item in legislation. So that's already predetermined. But I know as collaboration and other opportunities Bryan had mentioned before, and I'll let Bryan speak about partnerships with the SAMHSA grant that they were able to put out to support the recovery high schools. Bryan, did you want to speak a little more on that?
Sure. Yeah, we can. I'll speak briefly about some of the programs that we're either in the process of starting or have just recently started. We mentioned the after-school enrichment programs. These are based at 3 of the 5 recovery high schools. And again, it's really to provide supportive services during the after-school hours, which we know are, can put students at significant risk with lack of supervision and that sort of thing. So we've just started those programs in 3 of the 5 recovery high schools. We talked about the school-based day treatment program, which we're embedding at Independence Academy in Brockton, but we're also really looking at some school-based intervention programs, not necessarily through the recovery high schools, but through community schools, community districts across the Commonwealth. We have a long-term case management model that we now have in 22 schools. We've just secured funding for another 11 school districts. So we're thrilled to have those supportive case management services in. Again, that's really designed as an intervention program through some of the SAMSA funding. We're actually exploring green care, which is using animal therapy and or like a wilderness therapy to engage kids in treatment. Again, we're trying to find innovative ways to engage with youth and their families. We have just put out a community innovations grant. We know that again, there's a variety of different programs that work, taking things through a race equity lens. We know a lot of the quote unquote evidence-based practices are really geared towards white males. And we want to make sure that we're finding programs that work across populations. So we've opened up a community innovations grant to really work with students within or youth within their communities. And then we also have Project AMP. Project AMP is a short-term mentorship program that we're actually, we've embedded in several high schools across the Commonwealth, but we're also we just released a grant to embed these in community-based programs as well. Taylor had mentioned YMCAs, YWCAs, Boys and Girls Clubs. These are where the kids really congregate and meet, and we want to provide those early intervention services where the students are, kind of boots on the ground. So we're really looking to train up those, that workforce to engage youth as early as possible. So again, our shift really has been from residential treatment to community-based approaches, such as the adolescent community reinforcement approach for outpatient care, and then several intervention programs that are community-based and again located across the Commonwealth.
Awesome, thank you. Sarah, another question for you. What are some of the key ingredients of an effective recovery high school, and what can traditional schools learn from recovery high schools?
I think so much of this has been covered already by the wonderful panelists. And I think Roger's presentation that took a scan at just some of what was offered at Recovery High School did really nice justice to this question. So I won't really belabor any of this. Just to note some of existing recovery high schools across the country, some of the key elements are things like offering individual counseling, making certain that the adolescent is getting support outside of the school, having family involvement, having co-occurring disorders addressed. And then one thing that I think is also really a key ingredient is broadly defining recovery, just ensuring and recognizing there's multiple pathways to recovery. And so the typical kind of historical approach where a teen had to be in treatment and then be abstinent for 30 days before being admitted to a recovery high school doesn't necessarily reflect the reality. And so again, what we heard from Bryan's group, I think it's so innovative what Massachusetts is doing, how Massachusetts is using a community-based approach, really thinking more about prevention and early intervention, because you don't need to have failed out of treatment to go to recovery high school. Recovery high school can be beneficial for kids across the spectrum.
Thank you. All right, next question for Roger and Ryan. Want to weigh in on this. We have seen increased attention on addressing mental health needs since the start of the pandemic, the social unrest following the murder of George Floyd, and increased isolation and suicide ideation among teens, especially with Black, Indigenous, and people of color. During this critical time, what were some of the challenges that recovery high schools experienced, and how are you all deploying intentional programming to increase access and restoration to BIPOC populations in recovery high school spaces?
That's a whole panel in and of itself. It's such an important question going to the core of what I want to stress for recovery high schools. We were wrestling with this issue pre-pandemic. And I'm not one of those persons who likes to say it's a silver lining, because there's nothing that's a silver lining about this pandemic, but we all know that it has put a spotlight on diversity, equity, inclusion issues, and it's freed us up. It's freed us up. A couple things just to build upon is Bryan emphasizing the community-based approach, and Sarah's talking about multiple pathways, right? I think two very key concepts that we know are really important to equity and access. So when the schools first started, it was awesome. We were having great success. There was a very vibrant residential component in Massachusetts, and we were building our schools and our enrollment, but we noticed right away that it was mostly white. So 10, 12 years ago, we started this work and looked at the data with BSAS and developed different programs, restorative and diversionary, with schools and with the courts, to try to create different spaces, going back to the stages of change, where we could meet young people when they were pre-contemplative and contemplative. And instead of them getting punished for making poor decisions or impulsive decisions, create spaces where they could reflect and work through those issues and go through the stages of change, however it worked best for them, and create different pathways for them to get help and support. So instead of trying to, hammer a square into a round hole, trying to fit people into a construct like a residential system that might not be the best fit for what they're looking for, we've now been able to totally and completely kind of commit to looking at how do we really build out these other pathways and these community-based approaches that we make sure that every person who's being impacted negatively by drugs and alcohol has an opportunity. So that has been really freeing. And BSAS and DESE in Massachusetts have been amazing. Taking something that's really difficult and challenging when you see programs closing that have been longstanding and successful, and really being thoughtful about it and shifting the resources into places where we can realign what we're doing with the needs of the students and communities. And it's happened very quickly. So that's why it's, it's really, I'm proud to be sharing this panel with Bryan and Sam, because they've really partnered with Recovery High Schools to help us make those shifts. And I put in the chat box, if you think things you're proud of professionally, the document that was developed by Faces of Voices, Association of Recovery Schools, other recovery-based organizations related to diversity, equity, inclusion that we're now trying to filter down to the school-based level, really trying to make this a core foundational issue, not just at the national level, but at our programs. It's a great document and a roadmap for what we're working on right now.
Great. Ryan, did you want to weigh in on that question at all?
No, I mean, I think Roger speaks for us as a group. I think he hit the nail on the head, and no, I don't think there's anything else to add. Thank you.
So kind of a follow-up. So building off of that, how is your plan addressing the social determinants of health among students through the lens of family engagement and transportation? Roger, if you want to.
Yeah.
Take
do you want to take transportation, Ryan? Because I don't.
Yeah, I mean, I think accessibility has proven to be a huge barrier for us. And I've been at the school for 8 years. We're working legislatively to try to create mechanisms for, to consider ourselves as regional schools, which we are regional schools. I mean, I serve the whole southeastern region of Massachusetts. And we're trying to just qualify ourselves as such so that we could apply for transportation reimbursement. Right now our transportation is provided really through us. We provide transportation for students, and a couple days a week, students are relying on their families. And so to bring in the equity access issue, there's families who don't have transportation. There's families with single parents who are working and can't get kids to and from schools. The average student travels 40 miles a day to attend Independence Academy. So obviously a huge issue, and one that certainly impacts, access for us. I forget the first part of it. I apologize.
But I can take the family engagement piece, because if you looked at like what we identify as core components of the Recovery High School model that was in the presentation, family engagement is one of the ones that's front and center. And I think when you talk about what makes a Recovery High School different, I guarantee you, if you go to any one of the 42 Recovery High Schools across the country, that family engagement is like a foundational piece of what we do. I know at Ostagai, a parent, a guardian, or a caring adult, and every young person has one of those, or hopefully multiple, is part of the process from the first time we meet with the young person until enrollment. And then we have several different ways we engage parents through parents' nights, weekly check-ins, daily check-ins in some cases. And it's just an ethic of Recovery High School, because we are a smaller model. Where we're not working with a large number of students. We know that the more engagement we do with families, that foundational piece, the more success we're going to have with the young person. It's not a linear process. Young people who are trying to make changes in their relationship to drugs and alcohol, it can be bumpy. They can have periods of success, they can fall down, and they need to have a really well-defined system of support surrounding them to help lift them up as they continue their journey.
I would just add real quickly, because I know it's been asked a few times, and I know that it's been sort of alluded to, but I think for me, it's just as important to involve a family as it is to talk about substance use when it comes to recovery schools and the work that we're doing. So I think family engagement, it has to be a critical part of the conversation. Who exists? Where is your social support your support network at home? And how does that impact you both positively and negatively? Just as much as what substances are you using and when. So, for us, there's not one domain that's more important than the other. They're all interrelated. Substance use impacts your relationships at home. your relationships at home impact your substance use. So, you know, we look at all of these domains, you know, from an equal perspective.
Thank you. So the next question, let's throw this out so everyone on our panel to weigh in. So when it comes to recovery high schools, what are some of the barriers, and who do you need to build your recovery high school Avengers team, and why? Who wants to? Roger or Ryan, do you want to start off?
No, I can take that. I mean, a little bit like in the 2-pager that I put in the chat box at the beginning, which was done by Dr. Andy Finch, who's done a lot of great research on recovery high schools. It really kind of highlights, you know, what the biggest challenges are for our schools. And we've really struggled across the country recently with enrollment in Massachusetts and other parts of the country. And a lot of that's due to shifts that we're seeing in our communities. And that's why this is such a great panel to have, because in Massachusetts, instead of being woe is me, what happened to all this great programming and all these students we worked with, we know that the need is still out there. So we're shifting our model and realigning and working together to meet the needs of our students. And so that's one of the big challenges, is trying to keep enrollments up so that we can keep recovery communities going. And it's talking about, like, you know, like, I'm not a superhero person, so I'm sorry. But like, I just think, once again, Massachusetts models this. You know, what for a recovery high school to be successful, and I've said this previously, we can't exist in silos, right? It's very challenging work. It's very nuanced. It's very, in some respects, it's simple, but it's also very complicated. And it takes, you know, thought partners across the spectrum: public health, education, and in the community, right? And in Massachusetts, in the 5 recovery high schools, that exists, where we have those partners. Some of them are funders or supporters. And so it's not really it's not, you know, being a superhero, as we find out a lot of time, isn't about having these great, incredible powers or magical skills. It's about persistence, resilience, and learning how to work with others and collaborate, and truly collaborate. So even though at this point in time, the recovery high school experience in some respects is one of the most challenging times for us in Massachusetts, it's also one of the most rewarding, because we're going to come out of these shifts from making stronger and meeting the needs of our community in a better way. So I just think the superpower that's always awesome and great to have is, you know, the ability to work and collaborate with others.
Yeah, I would add, I think a key barrier, and I think I'm getting a peek at some of the Q&A coming through, and this is a theme throughout, is stigma. And I think a lot of times we assume it's stigma from the teens. And in my experience, it's often stigma in the family. Teens themselves, you know, are pretty accepting of other teenagers and will often understand and be supportive, but it's the family that really feels the overwhelming stigma of admitting that they need help to try and address and support their teenager. So if I could have a member of the Avengers team, it would be like a community stigma buster that would basically be helping to do stigma reduction campaigns, marketing, just awareness building of just how valuable recovery schools are, and that it's, again, not just for teens that are really struggling and have had a serious bout with substance use disorder, but that it can also be helpful for people earlier in their recovery pathway.
Bryan or Samantha, did you want to weigh in on that question?
No, I mean, I just agree with everything that Roger said. And as far as the awareness, I know that at DESE, that is one of our goals, to help create awareness of these schools and the services they can provide and the impact that they have on the students' lives that they touch. So it's just, I completely, agree with the last statement that we do need to build awareness of these programs and help to remove that stigma, and just have more conversations about them, and have more conversations of what they can do, to help the adolescents that are struggling right now.
Yeah, I certainly agree with all of that. And again, Massachusetts no longer has substance use disorder residential treatment programs. We have thrown that language out. We are now offering co-occurring programs because that's where our youth are at, and that's where we need to be kind of focusing. And we need to have flexibility within the recovery high schools as well to be able to really work with that population. And there are some, Samantha and I were talking earlier this morning, there is some legislative language that prohibits some of that, or it creates a barrier for some of those students to get into some of those programs. So again, we really need to shift and kind of adapt and work with that co-occurring population, because that's truly what we're seeing now. So again, flexibility and adaptability would be two key components as we continue to move forward in this process.
Great. Bryan, did you have anything you wanted to add?
Just quickly about schools, because I think what we have historically seen is that a lot of referrals from recovery high schools come from the treatment, world. So kids go to treatment. There's a clear issue. I think again we'll go back to equity and access, where the middle class or higher socioeconomically standing family that's white goes into the treatment model. I think the treatment statistics would support that's who engages in treatment. When you look at kids youth who need to be engaged in some level of intervention, schools are really at the forefront of that. They are the ones that observe this behavior on a regular basis. They see the kids who aren't showing up. They see the kids who are school avoidant or, who are running into trouble and who present as behavioral issues or challenges, who are not academically, making progress. And when you present them with this option of, maybe go into a program to engage in some, real change work and some deep work on, holistically looking at their life before they're so far down the river that you're, trying to, get them into a inpatient program, I think it becomes like this stigma of like, what we're going to have to now, put up some money to get this, I say pothead or, whatever language you want to use that has historically been, this kid who just wants to smoke weed at school, what now we have to get him to a place, and it's no, you don't. Yeah, you do. You need to do what's right by the student. So I think this, kind of knocking down some of that stigma of like, these are the kids at our school that we, look at them as maybe troublemakers or these kids who are causing us problems. Yeah, you do need to go the extra mile for them and get them engaged with a program that could potentially, sort of head this off, before it gets to be too much of an issue.
All right, thank you. I have one last question, and I see some great questions in the Q&A box I want to get to before we end. As we are the Prevention Technology Transfer Center, the next question is related to prevention. As a New England PTTC, our work is focused on supporting the prevention field and implementing science-based prevention programs and initiatives through our training and technical assistance services. Lately, this has included some focus on training for our prevention field around the opportunities to work across the continuum, including those working in recovery. And so, Roger, this question is for you and Ryan and anyone else who would like to also weigh in. But Roger, you've spoken about a shift or intentional inclusion of prevention work. Do you care to talk about that paradigm and any initiatives you're working on currently?
Yeah, I mean, I think we've hit upon a little bit of this, and then Bryan kind of referenced some of the shift in funding that BSAS has put out. Like, we're one of the 3 recovery high schools that got funded to do this grant that basically is more of a prevention, education, early intervention grant than a recovery grant. Ryan just got funded in a different stream of money. I think it both initially came from SAMHSA to do some similar kind of innovative work about like what we've been talking about. How do we find ways to meet our students and families where they're at? So yeah, I think that I'll just stop there and put a point on the importance of language. Like, even in my presentation, even when I was doing the first slide and there was recovery still in it, I struggle with that word because that's not what a lot of the young people, families are relating to. They don't relate as being in recovery or wanting to be in recovery. But at the same time, recovery is such a powerful concept and it means so much to so many people. So really, we're really trying to figure out language and how we present to families. So this is tied into stigma, but trying to have open, transparent conversations and bringing it back to, is this behavior having a negative impact on your life? So whether it's marijuana or opiates, obviously the stakes are different, but the concept is the same. If it's preventing you from functioning on a regular basis, let's find a way to get you to a place where you can reflect on that, get ready to take action and take action. So language is really important as part of this conversation.
All right, thank you. Anyone else want to weigh in on that question? All right, so we had some excellent questions in the Q&A box. So I want to try to get to as many of these as I can before we still have about 15 minutes left. We do have some comments, recorded comments we're going to get to in a little bit. But this first question is for Rob, and it's maybe been addressed a little bit, but anyone else wants to kind of address this? His question is, has there been any problems concerning stigma with recovery high schools? Have any concerns been raised about participation in the high school identifying students as having substance use disorder? In particular, he's asking about any particular privacy concerns. So anyone want to speak to that question?
I mean, so basically about stigma, is that the?
Yeah, it's about concerning stigma with
Yeah.
participation in recovery high schools.
Well, once again, I feel a little guilty because being part of the National Association, I get to go to other recovery high schools across the country. And then when I come to Massachusetts, I feel so fortunate, even if there's been shifts in funding and there's part of the continuum that is not the way it used to be or shifting. Massachusetts has put such emphasis, even on their campaign against stigma, is an example from many years ago, which had a big impact. Is, we don't have time for stigma. It's about creating spaces where young people can have open, honest conversations that include their families about, in this case, how drugs and alcohol are impacting their lives. So absolutely, there are families who come to us who there is some stigma and there's some shame. And some of it is depending on demographics and culture. But once again, in Massachusetts, in the recovery high schools, that's why we try to be so sensitive to meeting students and families where they're at. We use motivational interviewing. We're not there to tell a young person you have an issue. We're there to help guide a young person and family through a conversation about, you have these goals and you're struggling meeting them right now. Is drugs and alcohol part of that? And so how do we move forward? So we just try to blow past stigma and get to, hey, what's in the best interest of that family and student? And in Massachusetts, I definitely seen a positive shift in that in the last 15 years since recovery high school started.
Next question is from Gabe from Maine Youth Action Network. How can community-based youth engagement organizations position themselves to support recovery high schools or families navigating recovery?
Can do
Go ahead,
that
Roger.
too. I was waiting for Bryan to step in because he's playing in Massachusetts. He's playing a role in that, like by allowing the funding, broadening out funding to organizations that maybe traditionally wouldn't be considered to do this work, right? Like all this money traditionally has to go to recognized treatment programs, or the same programs get the same funding every year. Instead of making a shift in like the type of services we're providing that broadens it out and allows community-based organizations to be part of this process. Osagai High actually is operated by a community-based organization, Action for Boston Community Development. It's in collaboration with the Boston Public School and a substance use foundation called the Gavin Foundation. They're amazing. So there's all sorts of different roles for community-based organizations. You can run a recovery high school, but especially with the shifts that we're doing and that Bryan and BSAS and DPH are doing, they're opening these opportunities up to community-based organizations to get involved in some of this prevention and education work on the front end. And it's awesome. It's a great change because you have more people playing in the same sandbox and get a chance to collaborate, connect, and build our resources and services that we have for our young people.
Yeah, just to build on that, again, the after school prevention program was, or the enrichment program was something we brought up 3 years ago and proposed. The school-based day treatment program was something that we started working on 3.5 years ago, and it just came to fruition. Again, start with the concept, talk to folks that are in your state agencies that oversee substance use or addiction services, and just start the conversation. It did not happen immediately. I mean, again, it took a lot of pounding on the table and kind of a lot of persistence to kind of move these programs forward, but we have finally in a position at DPHB SAS to start recognizing the importance and the need for youth intervention services. And we have the full support of the Bureau and the department. So we're kind of moving forward at full steam, but it did not happen overnight. It was a long and intensive program, and it took a lot of persistence on the office's part to get these programs in. And a lot of the work starts at a grassroots level. So, coordinate with like-minded people within your community, and then start engaging in the conversation with the folks that kind of oversee the services within the state.
Great, thank you. All right, this next question from Kristen: are the students at the recovery schools utilizing MAT? And if so, how was initial outreach about this kind of resource service perceived?
Yeah, I think I'm the only one on the panel who's can take that because I'm a Ryan and drop off. Absolutely, like when the recovery high schools in Massachusetts started 15 years ago, it kind of coincided with Suboxone becoming available to adolescents. And I remember, like, when it first happened, there's a lot of people who are dead set against it. Like, this is not the way to go for adolescents, and why are we doing this? And now 15 years later, medically assisted treatment has become part of the toolbox that some of the young people have, not in an irresponsible way. But once again, there's different pathways into recovery high schools. There's different pathways in recovery. Medically assisted treatment is absolutely a pathway that is available for young people. And I don't want to say it's encouraged or discouraged. It depends on the young person, the supports they have around them, and what's being indicated is in their best interest. So in recovery high schools, we have students in medically assisted treatment. We have policies for that and how that's incorporated into our drug testing and our relapse policies. And that wasn't the case 15 years ago. Medically assisted treatment was a 4-letter word, right? And now it's just a natural part of what we do. Once again, it's driven by a great reason, because that's what the research is showing is effective in some cases, and it's in the best interest of our students and families. And if that's the case, then we're gonna figure out a way to adopt it, incorporate it into our model.
I'd love to just chime in on my soapbox that we need so much more support evaluating medication for opioid use disorders in youth. Right now, Suboxone is the only treatment that is approved for youth that are 16 and older. There is nothing approved for youth under the age of 16. Methadone and Vivitrol are not approved until 18 and up. Maybe throw in the chat. I did a review of 22,000 abstracts. Guess how many studies looked at medications effectiveness in youth age 16 and up? Just maybe throw it in the chat how many you think out of 22,000 looked at medication. I see a 10, a 3, a 10, 100, yeah, 4 studies. So this is an area that we really need better guidance on. And so while you're advocating for other supports, we really need just better evidence on medication in youth.
Great. One last question. We just have a minute or two, and this could be a whole panel by itself, but get your elevator pitches ready. How do we address the stigma of substance use disorder and mental health issues with teenagers? Bringing this up seems to scare them off. So any thoughts on when we discuss this with teenagers, how do we do it in a way to not create that?
I think there's a push in the state, and I think in all states, especially in light of the pandemic, to bring forth mental health, behavioral health, co-occurring disorders to light. A lot of the PD for school professionals is geared around that, how to start conversations, how to talk to adolescents, how to recognize that there might be a concern for substance misuse or use. And I just think it has been brought to light because of the pandemic, and it is being pushed out and moved forward. I know, at least in the state of Massachusetts, but from things that I read and things that I see, I think it's across the nation. So.
Anyone else want to weigh in on that?
I'll just amplify what Roger and Ryan said earlier, that don't lead by talking about substance use and mental health, lead by talking about the teenagers functioning and just understanding what their goals are, what's getting in the way of their goals. And usually the need to focus on substance use will come up naturally, and because it's part of the teens functioning and what's getting in the way of their health.
Great. All right. Well, I want to thank the panel for being with us this morning. Lots of great information, and I've seen lots of great conversation and connections. And looks like future conversations are going to happen after this. So I think Taylor, we can already chop this up as a marvelous success in that way, that we're spurring off some more energy. I did want to share a brief video from someone who was going to be with us, but unfortunately was not able to join us, Deirdre Calvert, who's the director of Massachusetts Bureau of Substance Addiction Services. She did provide some closing remarks for us, so I'm going to share my screen now, and you might want to turn your volume up a little bit. It is a little low, so and here we go.
Hello, everyone, and thank you so much for the opportunity to speak today. I truly wish I was there in person. My name is Deirdre Calvert, and I am the Director of the Bureau of Substance Addiction Services at the Massachusetts Department of Public Health, and I'm here to give some closing remarks on the recovery high schools in Massachusetts and the important role that these schools play in supporting adolescents' recovery from substance use disorder. For adolescents in recovery from substance use disorder, attending school can put their ability to maintain their recovery at risk. School is a setting that may result in interactions with peer groups who are actively using alcohol or other drugs, and unfortunately, after treatment, students may encounter multiple risk factors, particularly if they're returning to the setting where their substance use disorder began. In July 2018, the oversight of the recovery high schools was transferred from DPH to DESE, our Department of Education and Elementary and Secondary Education, by the Massachusetts legislature. However, BSAS still recognizes these 5 recovery high schools in Massachusetts as an essential part of the overall continuum of substance use disorder services. As youth step down from residential placements, it is incredibly important to continue supporting them in their transition back to their homes and their communities. For students struggling in a traditional educational placement, recovery high schools can provide an environment which recognizes the immense challenges of recovery and position students to discover a positive peer support network. Recovery high school programs play an important role for these students by offering them another educational option in which they can feel supported in their recovery while still working towards a high school degree. Many of these students have experienced gaps in their academic careers because of time spent in treatment. They are at increased risk of dropping behind or dropping out of high school or falling severely behind in their academics. Recovery high schools offer support to these students and their families to meet each student's individualized needs and help them to reach success in their academic and personal goals. Some of the continuing collaborations between BSAS and the recovery high schools that I'd like to highlight include utilizing our state opiate response grant funding through SAMHSA that supports after-school enrichment programming at 3 of the recovery high schools, including educational tutoring, recreational activities, year-round programs, including after-school and out-of-school activities, and intervention recovery support programs delivered in a meaningful, effective, and purpose-driven manner. School-based day treatment programming at the Independence Academy Recovery High School in Brockton, a 45-day assessment model designed to serve students stepping into or out of a more restrictive treatment environment by providing year-round, developmentally focused, targeted substance use prevention and intervention services, individual mentoring, case management, educational programming, family support services, and referrals to community-based services, as well as 24/7 crisis support. We also are providing technical assistance at the capacity building through a contract with the Institute of Health and Recovery, IHR, which provides on-site workforce development workshops on topics such as trauma-informed care, motivational interviewing, and group facilitation skills. Also, ethics and boundaries and family engagement. This is in order to ensure the consistent high quality of services within the schools. We are so proud to continue supporting the recovery high schools across the Commonwealth. Their unique position within the continuum of SUD services allows them to provide much needed support to an incredibly vulnerable population in need of specialized treatment, understanding, and attention. Thank you again for this opportunity to discuss and promote the good work that the recovery high schools do in Massachusetts. And thank you for all the work you do to help adolescents with SUD. Again, I hope next year to see you in person, and I appreciate your listening. Thank you. Hello, everyone.
Thank you. Thank you, Scott. Thank you so much for the excellent moderation. Thank you. We're so fortunate to have this incredible panel that has inspired us with so much expertise, but also tangible goals. Thank you to our guest speakers. Sam, you're an inspiration. Roger Oser and Ryan Morgan for their leadership. Dr. Sarah Becker, Brian Jennings, Samantha Graham, and Donna Dimitrovic for also lending their expertise, and Deidre Calvert for their closing remarks. Scott, Aaron, Sarah from the Prevention Technology Transfer Center, who helped make this moment possible. And it speaks volumes that all TTCs are represented here today. That's the Mental Health Technology Transfer Center and the Addiction Technology Transfer Center. Thank you so much for your support. Please fill out the GIPRA for our friends at the PTTC. If you've learned, felt enriched, or hopeful today, it's also an opportunity to tell us what sort of prevention supports we can bring to you in the future. So what can we take away what we learned today? Persistence, resilience, and collective thought leaders. We need support and evidence for MAT in ages younger than 16. Sam said, easy to access systems would be the best starting point, and then having experienced staff with a desire to help and acknowledge of substance abuse, having amazing, kind-hearted, intelligent, supportive staff. And I would leave it right there on Sam's voice. And thank you so much for joining us. We will be sending post materials to you so that you can review at your leisure. But thank you so much. Have a wonderful afternoon.